Hey guys, this is Saper Jamali. I go with the name of Dr. J. So often people ask me, do I have to remove my wisdom teeth or not? And that's a very common question. So many people are scared of taking their wisdom teeth out, but some cases we know that we cannot keep those teeth, so we have to extract them. Wisdom teeth extraction is very age related, which means that as we age, it becomes a bit harder to take them out. Now, every person is different. If your jaw is wide enough, big enough, and all the teeth are in contact and you're chewing with them, there's no need to remove those wisdom teeth. Those, we call them the third molars, and you just use them for normal function. But if your jaw doesn't have enough space for those teeth to erupt normally, maybe they get impacted on the back of the tooth beside it, or maybe they're gonna come and get impacted with the soft tissue coverage. Any of those cases grant us to extract the wisdom tooth either before it causes more damage or before it causes a damage that is gonna be irreversible to the area. For example, if a wisdom tooth is coming out and there is no way that these tooth can erupt into the mouth, but based on the angle and the cyst formation around it, we see a huge bone loss on the tooth beside it. These cases should be dealt with much, much earlier, which means that when you're 18, 19, 20 years old, with the panoramic x-ray and with the quick examination, we can determine if your wisdom tooth needs to stay or it can come out. Sometimes you also have to take out the wisdom tooth for orthodontics related reasons. If you don't have enough space for your teeth and we want to spread out the teeth, so fix the crowding and crookedness of the teeth, we need all the spaces. So the wisdom teeth are also part of that plan to take them out so we can maximize the space to fix the crowding. Another thing is that to wait until those teeth become infected, those impacted teeth, they become problematic, then you're gonna extract them. And that's when you hear more, not so nice stories about the wisdom teeth extraction, because when the area is infected, infection is acidic, and all the freezing material that we use, usually they cannot do their best job because they react and they become salt. Long story short, you do not want to wait for the wisdom tooth to become painful and problematic to take it out. If you have a discussion with your dentist and they recommend to take it out, try to do it before 25 years. Because after that, definitely the risk is going to become a little bit higher, the complications can go up, and also the healing period after that is a lot more.